Welcome to HIT Podcast, HIT, Human Resources, Insurance, and Technology. I'm your host, Toby Kennedy. As we do every week, we're dropping into your feed with what I hope are bite-sized, digestible, well-curated conversations going on in the space. This week's episode will be no exception. This week's episode is brought to you by Montage Insurance Solutions. And without any further ado, let's get right into it. You know how sometimes in HR, you're thinking like, boy, I wish there was another requirement, or I wish there was like another sneaky deadline thing that I'm just somehow supposed to be aware of? Well, good thing you follow the HIT Podcast. And good thing you're also smart enough to send this to all your HR colleagues. You know, you like, you subscribe, you follow us on a Tuesday, and you give us, 10-ish minutes, 15, 20 minutes of your time type of thing. We keep you up to date. So I want to talk about this gag clause that's in the CAA, the Consolidated Appropriations Act, right? So semi-recently, that act came in and was supposed to bring some transparency about in healthcare, and it had a lot of requirements and stipulations to it. One of them is this gag clause order, which basically says to health insurers and health plans, if you're self-funded, there's a prohibition on entering into contracts that limit access to things like provider cost, quality, data sorts of things, right? So we're really trying to push for some of this transparency, and there's a prohibition against entering into contracts that sort of limit that stuff. It complements the transparency and coverage rules that all kind of push together to say we need to make provider costs and put them into machine readable files transparent for everybody, so we can really start to see some of the costs going into our healthcare world. What does this mean for you? What this means for you is this gag clause is something that you need to make sure is in your plans, in your insurance. So if you're fully insured, we've spoken with all the major fully insured carriers, and they're doing this on behalf of their clients. So it's yet another thing that the recommendation is basically, let's just lock down in writing that this is being done. So reach out to your insurer and say, hey, I'm ticking another box because that's what these requirements make me do, because this is due for your plan December 31st, 2025. You have to have this sort of box ticked, for lack of a better word. On the fully insured side, the carrier is going to do it for you and field any government or any inquiries that come in about your plans. But you're going to want to double check with your specific insurer, right? I asked for all my clients. We asked around. They're good. They're taken care of. But the recommendation is reach out to a carrier representative and get confirmation in writing that they are indeed keeping you compliant with yet another compliance box that we got to check on the gag clause. Because it's basically filing an attestation, and this attestation has to be filed. The attestation has to say that there's nothing in our contracts there's no gag order preventing the dissemination of data. So if you're self-funded, you need to make sure you're talking to the consultant, the broker, talking to the TPA. You might be required to file an attestation. Maybe the TPA is going to be helpful, the broker, the consultant. But, this is one of those sort of lesser talked about compliance pieces, this making sure that the contracts don't have any gag order language in them that would prevent the dissemination of data and the attestation being filed on your plan's behalf. And therefore, if you are self-insured, we highly recommend reaching out to the TPA, the third-party administrator involved in this ecosystem, and double checking, are they filing this for you? Is an attestation on your behalf an action item? Do you have to do something? Is action required? Because ultimately this needs to get filed. So on the fully insured side, it's sort of handled for you. We just want to reach out to the carriers, file that letter away. On the self-funded side, might be done by the TPA, but certainly something to where you want to reach out and sometimes I joke, you don't want a husband and wife it, right? I thought you were picking up the kids. Well, now they're sitting outside of the school and no one's got them, right? So don't husband and wife this on the self-funded side. Have good communication. Reach out to everybody involved in your ecosystem and make sure you know whether or not this is being filed. because it is a requirement. It is due December 31st, 2025. It is due December 31st every year. This is now a new ongoing thing that you need to be aware of. It's been going for a couple years now, so we wanted to make sure ultimately we do an episode on it. We put it onto your guys' radar and we say, hey, lots of different compliance pieces going on out there. We want to make sure specifically that you know that you can't have that kind of gag language in any of your contracts that might prevent provider data getting out, and that an attestation needs to be filed. If you wind up feeling like we need to file this, it's the CMS oversight system. So that's where you need to go. You can look that up, Google that. We can even throw a URL kind of down here if you're watching on video here, but go to the CMS oversight system, and that's where you would file the attestation if indeed your company is the one that needs to make sure this gets done, because it does need to get done for your plan. So to get out, we've got a quick checklist for you. Number 1, review your contracts. Make sure with the TPAs, the PBMs, the network contracts that you really scrutinize language for any gag language that would violate this provision. Number 2, request data access. Confirm, if you're not already reviewing de-identified data, that you indeed have access to the de-identified data. This is yours. Number 3, amend any contracts that need to be revised. Do we need to review any and edit any provisions within our contracts? Number 4, get the attestation submitted, right? It's the CMS portal by December 31st. Make sure that that indeed is filed, whether it's you filing yourself or you reaching out to your insurers, TPAs, other folks in your ecosystem, and you at least getting written confirmation that it was indeed filed on your behalf. And that's it for this week's episode. We just kind of wanted to go over that one kind of lingering provision, as I said, and get you guys up to date on yet another piece of compliance. Thank you so much for joining us. Thank you to our sponsors, Rula, Excel Health, TrueHue, Montage Insurance Solutions, guys, keeping the lights on. We are blessed to be here. Thank you guys for joining us. Join us next week. Join us every week. And until next week, make this the best week yet.